Foam roll thoracic mobilization, I simply support the head, trunk in a good position, roll back, and there's many different ways you can do this. I involve diaphragmatic breathing. I find a restriction point. I take a breath in through my nose, exhale through my lips fully, and then hold that position, take full 3 breaths, and roll back out. You can also roll back and forth. There's many different ways to foam roll. Here are some progressions in sideline for thoracic extension and rotation that you can do. We use foam rolls to support the head and neck and to lock out the lower lumbar spine. It's important to diaphragmatically breathe when you do these exercises, so that you're engaging the diaphragm and the external obliques as you're rotating. Here are some progressions you can do in quadruped for thoracic extension and rotation. It's important to find the athlete's neutral position, help them engage their abdominals lightly. You don't want to over-engage and create too much stiffness, and diaphragmatically breathe through the rotations. Here are 2 examples of exercises to stretch the lats. One involves a squat maneuver where you're diaphragmatically breathing at the end range to try to pull the external obliques in. And the other, you're standing and rotating into your shoulder as you're diaphragmatically breathing to release the lats. The following is an integrated movement prep exercise that involves the concepts of thoracic rotation extension that we've been talking about, as well as other joints. When you've identified the athletic kyphotic spine, the next step should be a comprehensive treatment strategy. This should include soft tissue mobilization, foam rolling techniques like we use today, but also engagement of the external obliques. So we're working on pulling that rib cage down into a proper position, not allowing rib flare. These would be dead bug variations and other types of anterior core work in addition to the soft tissue work that you've already been doing. Once that's been done and you're working on thoracic extension rotation that's uncompensated, at that point these athletes should work on stabilization or strengthening programs for their scapula, for their cuff. It should be done after that work has been done. For the flatter thoracic spine, these athletes do not need rotation extension work, and it should not be done unless you want to create hypermobility. These athletes should proceed straight to stabilization and strengthening work.